Met. I'm the president for the Rotary Club of Harrisburg, and I invite you to join us for a traditional luncheon meeting, service on a Monday, or Rotary alternate meeting. Everyone's invited, and that means you. Check out our website or Facebook page for more information.
Well, I'm happy to introduce my colleague Lou Baverso. Lou is the president of UPMC in Central PA, which is the region's leading healthcare system with 7 acute care hospitals and more than 150 outpatient clinics and ancillary facilities, 2,900 physicians and allied health professionals, and 13,400 employees. So he's a pretty big deal. Lou has more than 30 years of healthcare experience in clinical and support operations. His diverse background includes both IT and hospital operations. He's held roles of executive leadership in both disciplines during his time at UPMC. He has served in a wide range of leadership roles, including Chief Operating Officer of UPMC in Central PA and President of UPMC Harrisburg, West Shore, and Community Osteopathic Hospitals. Previously, he was with us in Western Pennsylvania, where he was Vice President of Operations at UPMC Presbyterian Shadyside and Vice President of Operations and CIO at McGee Women's Hospital. Please join me in welcoming Lou Baverso.
So good afternoon. Thank you for inviting me to join this afternoon and talk a little bit about probably the first thing everyone wanted to know is who's the Lou guy, right? Because I have learned that Phil Gurner-Shelley has cast a shadow that I have constantly tried to fill. And he is enjoying quite a healthy retirement. And enjoying it to the point that he now sends jokes on a regular basis about what he would be doing if he was working. But I'm thrilled to be here. As I learned a little bit about the mission of the Rotary, in a lot of ways, our organizations are very much aligned in that it's about community need and serving the community. And that's really a lot of what you're going to hear from me today as I talk a little bit about UPMC in Central Pennsylvania. As well as, some of the growth that John talked a little bit about. We're about 5 years here, but we are built on top of a long-lasting and high-quality organization that everyone knew before as Pinnacle Health. And as I've come to learn in my time here, that was the merger of Polyclinic, where everybody came from at Harrisburg, apparently. So if I say Polyclinic in an entertaining event such as this, I usually get, I was born there, I've lived there, I worked there. And so that's a great testament to what legacy has been here. So let me just talk a little bit about UPMC in Central Pennsylvania. As John said, we are 7 facilities and a lot of ambulatory and outpatient care. We've been here, we celebrated our 5th year as UPMC in September of this year. We see about 1.4 million outpatient visits every year, and that's a lot when you consider the size of this region. We see about 229,000 folks in the ED every year, and we are a part of about 180 research studies, and that is pretty important for this region as we continue to develop the care that we deliver here, our ability to have access to those research studies with our colleagues in the Western side. We've got a number of urgent cares that have popped up across the region, as well as have had some really good successes in some of our key service lines that I'll walk through. Sean, if you go to the next slide, please. So as I said, 5 years ago, we became part of UPMC, and since then, we've invested about $910 million in expanding clinical services in this region to make sure that we could care for patients in their community, as opposed to always bringing them to one central place. In 2021, UPMC in Central Pennsylvania contributed $125 million in community benefits, and about 63% of that was to take care of folks that didn't have the means to pay. And that's at the core of UPMC. And those numbers are just what we do here in Central Pennsylvania. And I can't stress enough, it's about the community for us. The ways in which we can connect into the community is how we continue to see growth. We have about a $2.6 billion economic impact in this region through a variety of things that we do, whether it's from construction or from programs like we have with Ski at HAC or at HU, and other ways in which we can invest within the community. And our employees live and work in the same place and spend within the communities that they live as well. Thank you. UPMC Children's at Harrisburg has been one of our bigger successes. It happened during the pandemic. And so it kind of happened quietly because there was so much of everything else. But we have actually connected UPMC Children's Hospital from Pittsburgh into UPMC Children's Harrisburg. That's a 30-bed unit. It is uniquely connected with the use of technology for any of those services that we don't have on site here. We actually can, for lack of a better term, sorry, I've forgotten my IT skills, but beam the physician in from Pittsburgh to do a bedside consult with the physician provider here. It's been a good success story for us. It's been a need that we've had within the Harrisburg region, and one that we continue to build upon. That, coupled with our 40-bed NICU, gives us a 70-bed children's hospital in downtown Harrisburg. And again, something that we've been working to spread out into the community as well. And then the Hillman Cancer Center. The Hillman Cancer Center is one of only 50 designated NCI cancer centers across the United States. And this is really where we have really seen some great advancements for this region in terms of clinical trials. I'll talk about that shortly. And then last year, we introduced UPMC McGee Women's. And so, you know, Pinnacle has always had a long-standing, high-quality women's health program. By coupling it with McGee, we've now brought a number 2, I think, in the country, women's only focused research institute. So it allows us to bring women's health out of research and closer to the bedside. And again, an opportunity that maybe wasn't here before, or maybe wasn't here to the level that it is today. Go ahead, John. So in terms of children's, we are part, as I said, part of Children's Hospital in Pittsburgh. These are the specialties that in the last 3 to 5 years that we've actually launched here that are on site in Harrisburg in our children's specialty location in Lemoyne. And then again, have this ability to connect back to those that aren't here. Some of these providers actually come here from Pittsburgh every month and spend a couple of days here seeing patients in person versus any kind of a telemedicine visit. And a number of these providers actually live and work within our community every day, serving the young children of Harrisburg. Okay. The Hillman, again, this is really, again, where I really can't focus enough on. We have 440 active clinical trials that are running in this region. So patients that present to the Hillman Cancer Center with a unique cancer or with a cancer that is has a clinical trial available to it, through some technology that has been brought to us by the Hillman, we can actually enroll the patient in that trial here in this region. They get all of their care in this region. And only for those superly high advanced care experiences are we asking the patient to go to Pittsburgh. And I think that's a little bit of a different story than perhaps folks may have thought when UPMC came to the region, that the idea was everybody would go back to Pittsburgh. And really the idea for us here is to build a hub and spoke strategy where Harrisburg is the hub for this region. And we'll actually service patients out of the North Central region here. So we'll bring patients from the Susquehanna, Williamsport area that don't have services and access to those services there down here to Harrisburg, using the Harrisburg, West Shore, and community campuses as kind of the hub for this region. So a lot of great work that has happened over the last 3 years, all while fighting a pandemic, just for fun. So I've had a number of good new things that we brought here. We've done a minimally invasive robotic bronchoscopy. That's way out of my league, but it was, the physicians were really excited to bring this technology through this region, and it has grown since we brought it here. And we've had expansion. Our Hillman Cancer Center has expanded across the region. So from here in Harrisburg to Carlisle, down to Hanover in January, we opened a new Hillman Center. And we actually have built a beautiful cancer center down on the Memorial campus in York, Pennsylvania. Again, all of those centers connected back to the hub here at the West Shore, and also a part of the trial program at the Hillman Center in Pittsburgh. Next slide, please. McGee. So again, McGee, I started my career in McGee a long time ago. Have seen some phenomenal things in women's health come out of McGee. See a phenomenal opportunity here for us in the women's health space to be able to take care of women as though they've never been taken care of before. And the fact is, women present differently with a number of conditions. And so the more we focus on women's health and those providers that are interested in women's health, the better that we can raise the level of care. This year, we opened a level 2 NICU in Carlisle. That has something that hasn't been in the Carlisle Hospital probably for 30 years. And so we're excited to be able to have that in that community to service the Carlisle community and the service area there, as well as a level 2 NICU in the York Market and Memorial. Again, alleviating that need of having to fly those babies into Harrisburg for care and actually being able to take care of those children in the community where they are born. We do about 6,300 births here in this region. A good number of those, almost greater than 4,500 of those, are here in the Harrisburg Hospital. And I heard a statistic, but you can't quote me because I'm not 100% sure it's right yet. I'm still validating, but 1 in 8 were born at Harrisburg from this Harrisburg region. And so again, a lot of good momentum, a lot of great community involvement in terms of what has happened at the Harrisburg maternity and NICU. And so we thank the community for that. Next slide, please. And then, what we've been able to accomplish in the last 5 years, just to kind of give a flavor. If you haven't used our services, you may not know what we have available. So we completed an $85 million expansion to the West Shore. The ED needed to get bigger. We added 12 additional ICU beds for a total of 24. We built out our operating room suites there. And actually have been able to launch vascular services on the West Shore. So again, the availability of community medicine in the community. We're currently adding some enhancements to the Hanover ED, particularly around behavioral health services. And in the Lancaster Lidditz area, we've been able to add services there that hadn't existed before. So again, all about looking at what the community needs are and the way in which we can meet those needs. And as John said, we've grown in terms of providers, well over 2,000 when you count for our advanced practice providers that are partnered within our region with the medical provider, as well as this year alone in 2022 have onboarded 200 new physicians and specialties across the region. So we continue to expand. We just opened a Hershey in our Hershey area, downtown Hershey, urgent care, as well as access in February to all of this medical specialties of UPMC. And most importantly for us here in the Harrisburg region is our build out of what we call the endovascular suite. And this is for patients that are having a stroke where there is an intervention that by thrombectomy that we can intervene with. Up to this point, we've had to send every patient out. That's about 150 to 200 patients that presented in one of our ERs needed to go somewhere else for that care. In September, we launched our endovascular suite. We can actually keep those patients here in Harrisburg, treat them. Time matters when you're talking about the brain. And so we're reducing much time off of the care that perhaps needed to be deferred somewhere else can now be cared for in our own hospital. And the build out of orthopedics, again, across this region have seen great successes in what we've been able to do from an ambulatory perspective, doing more same day joints. I don't know that I'd be signing up for that. A little too painful for me, but some do. I mean, it's where it's going, right? It's where medicine is going. Medicine is going to a point of doing more in an ambulatory setting. And so we're trying to prepare ourselves for that shift. Next slide, please. A lot of innovation. Much of what we do revolves around innovation, and it's not all based on research that's happening in Pittsburgh, but things that are happening right here. We did the first implant of the next generation TAVR for the heart. We did the first fully robotic, minimally invasive esophageectomy, and a number of other firsts. But one that I'm the most proud of is the work that we're doing around veteran services. We have figured out a way to provide to our veterans in this region a great service from a concierge perspective. So veterans that can't get the care within the VA system for whatever reason, mostly around time, we have actually coordinated a one call where we bring we schedule the appointment, we make sure the follow-up is back with the VA, we make sure that the veteran has any other needs within their time within our care that they're actually getting it. They're not frustrated by trying to find services or look for other alternatives. We've seen this work so well here. We're actually expanding this across the UPMC network. And there's a lot of things within UPMC now that have come out of UPMC in Central Pennsylvania for the great work that they're doing. You'll see more as we continue to support the veterans within this community and within the communities across UPMC. And then our workforce, right? This is huge. We can't, like all of you that have businesses, you can't do any of this without a workforce. And so this year has been really an undertaking that I've really spent a lot of time with in building partnerships with our local universities and colleges, right? And not, I'll pick on ski because I can see, I'm not going to ski and saying, hey, I need nurses, send them all my way. But actually coming to the schools and universities and saying, how do we partner together? How do I help bolster enrollment for you? And then how do I introduce those folks to the job market once they're able to graduate? These are just a few examples of what we've been able to achieve. And in some ways, we've actually been able to partner alongside and offer something that hadn't been offered before. And so the School of Nursing at Harrisburg University is a diploma program. We haven't had a diploma program in this region for quite some time. It's 16 months. We're targeting those folks that perhaps didn't want to go to a community college or didn't want to go to a four-year school, but gives them an opportunity to come into a nursing degree and then use those other resources to begin to carry on later for their bachelor's, their master's, et cetera. We're building the leaders of tomorrow out of these programs and really excited about that. Again, have had great partnerships and the idea of this hub and spoke, right? So how do we use Harrisburg Hospital for what it is, which is a high level of care in all of the subspecialties, but then export that out to the Littitzes, the Carlisles, and the Lancasters of the world, as well as how do we then become a resource for those that are around us. And we've done that pretty well. We've got great quality to be proud of. Again, get with the guidelines in terms of stroke and neurological care. Harrisburg Hospital this month was one of the U.S. News and World Report top maternity programs for uncomplicated care. And so this is the first time we've participated in that, and we're excited to have it. Again, a number of other Joint Commission and regulatory things that we've met and continue to excel at from a quality perspective. Again, all around trying to deliver the highest level of care here in the region. And our community benefit. Again, as I said at the beginning, our organization is very much about the community and the impact that we can have. And so, and this year we opened our third UPMC Child Advocacy Center, this one in the Cumberland region down in Carlisle. It's 100% dedicated to anyone, regardless of who they're a patient of in the child space that is has been abused in some way or has witnessed abuse. The UPMC Pinnacle Foundation has been a great sponsor of this, and I need to give a hat off to them because they have sponsored so many programs for us in this community. The street medicine team is dedicated to the homeless population in the way we deliver care under bridges and along the river to ensure that our homeless population is cared for here. And we look for ways to help them from the time that they are medically in need to the time that maybe we can do something positive afterwards in terms of getting them off the streets. And our Passport to Success program, which again goes into the middle and high school level areas and attempts to attract folks to a healthcare career. We're like a small city in healthcare, right? I have every career possible. I could take everyone as SKIS graduates and put them to work somewhere. And so we need to do the same in our younger kids to get them thinking about healthcare careers. Most people, when they think about a healthcare career, think about a doctor, right? Or a nurse. Seldom do they think about a hospital administrator, and that's okay. But there are so many opportunities for our younger kids that maybe aren't college bound to take an entry-level role with us, tuition reimbursement the whole way through to wherever they want to be. And so we're focused very much about looking for the school district partnerships to be able to introduce that concept. Okay, so that's not who Lou is, but that's who UPMC is. For me, I've been here 3.5 years. I moved here in 2019. My wife and I relocated from Pittsburgh with 3 cats and a dog. Anyone want a cat? Let me know. They're all rescues. Unfortunately, the pandemic has had me introducing to folks with masks, so I'm now relearning everybody's faces and names. So I apologize if I meet you along the way, and we've met before. Excited to be here. Excited to see what we can do in this region, excited for what the region offers. And, you know, it's like one of the best kept secrets, I got to tell you, about Pennsylvania. The weather's better here, as I tell my friends in the West. So if it gets snow, it's not my fault. And, but it's a great place to live. You got access to everything, 2 hours away. I mean, all the things that you all know that I had to learn coming out here when someone said, "How do you feel about going to Harrisburg?" And so I thank you very much for the time. I thank you for your friendship and your attentiveness. I don't really think they all came here for me. So I'll take any questions that you have, and thank you very much.
Thank you so much for being here today. My mother was diagnosed with breast cancer a year and a half ago. She's 83 years old now, and we've been using the UPMC Hillman Cancer Treatment Center and have had such a wonderful experience with that facility and those people. So thank you for your part in helping to make that facility there for her. My question goes back to what you mentioned about the street team. My husband, James, and I are involved in some homeless activities with a group. And if we were becoming aware of a situation where there was a street person that needed some medical care, how would we get in touch with you or the street team? How do we do that?
So I will commit to giving you a better contact than me on this one. But we do have a dedicated team. I don't know that they have a phone number, honestly. They actually go out into the community and look for those opportunities. And so I will make sure that I get something back so you have a way to connect. Thank you.
Thank you for joining. And John, thanks for introducing Lou. Curious, certainly you spoke at a high level about everything that's going on within the hospital system. You didn't speak to the insurance side of the equation. How has that program come? It was certainly a very important part of the conversation in Pittsburgh. How's that coming together?
Yeah, so I think there's a couple things. So one, I think the conversation that you're probably referring to in Pittsburgh, we won't see again, right? I think that was a moment in history. And I think we've all learned something different out of that outcome. You know, the health plan continues to grow in this region. We are about 150,000 lives, give or take, John. We really have seen a big uptick in the government group of payer options. Commercial a little bit slower, number of reasons for that, right? It takes time. So I think what you'll see is the health plan will continue to grow, but it'll grow at a different place than the provider side will. I didn't honestly talk about them because I'm only on the provider side, and I figured John does a good bit of health plan talking along the way. But you know, there's advantages, right? When you have the payer and the provider together. And so we do function as an integrated delivery and finance system. You know, we hear that sometimes. Where we try to leverage the knowledge of both sides of the organization to do what's right for the member, the patient, or the community in that respect. But you'll continue to see that growth. Does that answer your question? I know it's kind of up there. Yes.
Thank you for joining us today and sharing. There's a lot of things that I had no idea UPMC was doing in the market. How would I find out more about the Passport to Success program?
Yeah, so we have, her name is Jen Kell Adams, and it's more than likely on our webpage, but again, I'll make sure that we communicate back with you. Her sole role with us is 100% to work with the school districts to find interest in these programs. And we can certainly share some additional information for you. It's 2 years in the running. I'm looking at Matt because the foundation actually helped us start it. We've had some good successes out of it. So we'll get you some more.
Just a quick thank you. I'm here with another hat on representing PA STEAM Academy Charter School, and you've been very gracious in loaning us expertise in Tina Nixon and then Stacy Pagan. Thank you so much. They've been great board members.
Thank you. Tina Nixon is her biggest fan, I think. Well, I'm sure she has she has a lot of #1 fans. When I first came here, I met Tina. It was like one of the first folks, and the amazing asset she is to the community and to us. Is that right? I bet that's interesting. We could probably talk a little bit later. Yeah, I didn't say which way was interesting, just so you know. But Tina's phenomenal. So thank you for that. I'll be sure to share that with her and Stacy.
Well, this is another thank you, not as much of a question, but I've worked in the homelessness community for 30 years and I've just seen how critical what you guys do is through the street homelessness program and so many other things. I mean, I worked on a housing project with Phil Garnishelli about 8 years ago, built some townhouses in Allison Hill. And I've been on a number of committees and task force over the years, and it seems like there's always some critical person from UPMC on the team that's working on street homelessness or healthcare related to house or housing with the homeless. So just thank you so much for your commitment on that end of the spectrum. We just really appreciate that.
Thank you. I appreciate that.